Many patients come to me and ask me, Doctor, why do I have knee pain after doing gym? Ideally, knee pain is supposed to reduce after gym. Am I doing something wrong, or is the gym causing an issue for me? Many a times, when there is a hip problem, it might be appearing in the knee because the nerve which is affected in the hip goes and sits on the knee, and this is known as referred pain. You have loaded your muscles, your joints in a manner which will help it heal, but you need to understand that you cannot immediately stop doing activities after the gym. You must have a 5-minute to a 3-minute cool down routine which helps your muscles recover immediately so that there is no overloading of the joint. So, another very important and a very commonly asked question. Many patients come to me and ask me, Doctor, why do I have knee pain after doing gym? Ideally, knee pain is supposed to reduce after gym. Am I doing something wrong, or is the gym causing an issue for me? So for this, I would like to take a little bit of your time to answer this in a very scientific manner. Knee pain, what you must understand from the outset is that the knee joint is not an isolated joint. It has connections to the joint on top known as the hip and the joint in the bottom known as the ankle. Many a times, what we find is that the biomechanics of your hip and your ankle joint is not correct, which leads to an overloading of your knee joint. And it is not only while doing gym, but also while sitting for a long time, going for treks, we ignore the hip joint and the ankle joint thinking the problem is only in the knee. Let me tell you about one such important factor which is known as referred pain. Many a times when there is a hip problem, it might be appearing in the knee because the nerve which is affected in the hip goes and sits on the knee, and this is known as referred pain. So it is very, very important that if you are having knee pain, you want to meet a professional and make sure it is diagnosed properly. Now, what are the common mistakes that people do in the gym? Number 1. Excessive squatting. When you squat with poor biomechanics, you are actually overloading your knee, causing more damage or rather more load to your cartilage, which in future can give you worse outcomes than better outcomes for which you joined the gym. Number 2, not taking rest between the exercises. It is very, very important to rest between every set and rest in a way that you don't just sit down but keep yourself mobilized. Number 3, a lack of proper cool down. And this, I think, is the biggest culprit of all. I see a lot of gym goers who after finishing the gym are so tired that they just sit down, have a chat with their friends, go for a lime soda and then go back home. But it is very, very important. You have loaded your muscles, your joints in a manner which will help it heal. But you need to understand that you cannot immediately stop doing activities after the gym. You must have a 5-minute to a 3-minute cool down routine which helps your muscles recover immediately so that there is no overloading of the joint. And in most cases, the problem is the patellofemoral stress syndrome, also known as the anterior knee pain syndrome, and in terms of medical language also known as chondromalacia patella. This usually happens because of poor biomechanics, lack of a proper warm-up and lack of a proper cool down. Another factor which leads to a knee pain is a sudden non-scientific way of increasing the weights. So please remember, if you are looking to increase the weights, number 1, make sure that you are ready to increase the weight of your gym. Number 2, make sure that you are properly hydrated and you have had a proper diet before you start increasing the weight. And number 3, if you are in stress, if you had a long day, please do not increase the weight of the gym that day because that will decrease your energy overload, causing further damage in the future. So what is the reason for this pain? Yes, biomechanics is one of the modes of pain, but what is the cause? The cause is cartilage damage, over-inflammation, overloading, and finally a breakdown of the knee biomechanics. So what is the practical solution? Number 1, don't just focus on your knee, focus on the hip and the ankle joints. Number 2, don't do weight training every day. You should do it alternative days to give your body rest and recover. Number 3, please do a good warm-up and a good cool down. It takes hardly 10 minutes to do a good warm-up and a cool down together, but this 10 minutes will save your knees for the future. And number 4, make sure that whatever you do is done in a scientific manner. If you do not trust your gym trainer, refer to a physiotherapist. If you do not trust the physiotherapist, come to a doctor. There are many sports medicine experts right now available who can help you out with these facts as well. And number 5, probably the most important, make sure that you hydrate well and you maintain your nutrition. So all the tips that I've given you are coming from a sports medicine surgeon who has done more than 3,000 sports medicine surgeries. And this is a scientific way of preventing an injury, not something that I've read on Claude or ChatGPT or any other AI platform. So if you or anyone you know is suffering from these injuries, is a gym goer, loves to train outside, do share this video with them because it will not only help you, but it will help them as well.